Welcome to Triage Cancer's webinar, Beyond Medicine, Housing, and Your Health. I'd like to start by first introducing you to our speaker for today. Melissa is a staff attorney at Triage Cancer, where she provides education on the legal and financial issues that may arise after a cancer diagnosis. Prior to joining Triage Cancer, Melissa ran the Health Law Partnerships at the Legal Aid Society of Southwest Ohio, where she worked with healthcare professionals to identify and address legal issues, improving social determinants of health, and achieving positive outcomes for the pregnant women and children who were referred through the partnerships. If you would like to read more about Melissa or myself, you can do so on our website.
Thank you, Sophia. Today, I'm going to be talking about the social determinants of health, and more specifically about housing in your health. I'm going to cover some ways you may be able to make improvements to your situation, and some ways that individuals who've been diagnosed with cancer may be able to make adjustments or changes to their home. Before we talk about social determinants of health or health equity, it's really important to understand what equity is and how that differs from equality. We often hear these terms used interchangeably, or that we should strive for equality. But this image really helps us understand why that's not true, and why the factors we'll be talking about today impact people in different ways. Equality means providing the same to all, whereas equity is about recognizing that we don't all start from the same place. And we have to acknowledge and make adjustments for imbalances. When we talk about equity, we're talking about fairness and justice. So to visualize that, what we see here are three individuals who are trying to watch a baseball game. On the left side, they're all provided with equal opportunity in the form of one box to each of them. There's equality. They each got one box, but the outcome is unfair. The taller one is towering over that fence. The middle height guy, he can see perfectly, and the little one, he can only see the back side of that fence. But when we look to the image on the right, where we see that the boxes have been distributed equitably, all three of these individuals are able to watch the game. The tall one doesn't need a box at all. And the short guy, he needed two to be able to see over that fence. Now the outcome is fair and just. All three of these individuals get to watch the game. I want you to keep this image in the back of your mind while we're talking about health equity and social determinants of health. Because when we get to how populations are impacted differently, we can understand better why equal treatment just won't solve the problem. So health equity has become a bit of a buzz term over the past few years. But what is it exactly? Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. So everyone gets the chance to be the healthiest they can be. To achieve health equity, we have to recognize that our health is not only impacted by our own biological makeup and our own behaviors, but also by outside factors, many of which you cannot change on your own. Health is a fundamental human right. And the right to health means we need to figure out where the inequities are and get rid of them so that everyone has a chance to be the healthiest they could be. Health disparities are preventable differences in health that impact populations who are at a disadvantage because of their social or economic status, their geographic location, and or their environment. If we want to succeed at reaching health equity, there has to be ongoing efforts at the societal level to decrease these health disparities. And we need to allow those who are victims of discrimination and other injustices the right to reach optimal health. Social determinants of health are the conditions in the environment where we live, work, and play that impact our health. There are different ways to think about them, but today I'm going to be using the framework used by the U.S. Department of Health and Human Services, which breaks them into 5 categories for their Healthy People 2030 campaign. So first we have education access and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. I'm going to discuss each of these briefly, but we'll be focusing on neighborhood and built environment today, and more specifically on the impact your housing can have on your health. Most of the social determinants of health are intertwined or overlapping, and improving them is going to have a huge impact on improving health for groups of people who tend to be negatively impacted by them. So the first one's education, access, and quality. When we talk about access to education, we're talking about the ability for children to attend early childhood education programs like Head Start and preschool, as well as the standard primary and secondary schooling from kindergarten through 12th grade, and then education beyond secondary school, whether that's trade school, traditional four-year college, or going on to get an advanced degree. And that it's not only about having the ability to access education, but also about the quality of the schooling. Studies have found that the higher the level of education you have, the more likely you are to live a longer, healthier life. In fact, someone with a high school diploma will live on average 7 years longer than someone who did not graduate. And if you do not have a high school diploma, you are nearly 3 times more likely to be uninsured with health insurance than someone with a college degree. You're also much more likely to avoid health care because of the cost. Unfortunately, those who did not finish high school are also more likely to have multiple chronic illnesses, things like heart disease, cancer, diabetes, stroke. More education leads to living a healthier lifestyle. There are studies that show that children who attend early childhood education programs engage in less risky behaviors in young adulthood and have better physical and mental health as adults. How is it that this connection occurs? Well, higher levels of education tend to be linked to improved financial stability, better access to good health insurance, and in turn, good health care, as well as better housing options. Education also gives people the tools to be able to navigate the system and analyze their own situation so that they can make decisions that will positively impact their health. Education is thought of as the great equalizer, but right now, educational equity seems a long way off. Improving access and quality will put children in a better position to ultimately improve health and well-being into adulthood. Having access to healthcare has a clear connection to health. When there's no access, there are no screenings, no one to turn to when you have a concern, and nowhere to access treatment. In rural communities, we often see this as an ever-decreasing number of facilities available and less specialization by the providers that are in rural areas, meaning that patients have to travel far distances to get adequate healthcare. In more urban and suburban communities, what we see is the availability of care in the community, but the inability to access that care because of barriers like cost, a lack of transportation, or few providers will actually accept certain types of health insurance, like Medicaid. There's also the issue of timing. When you have to choose between going in for a doctor's appointment or working to maintain your housing or food stability, you're unlikely to choose the doctor, especially if you're not experiencing any symptoms. And then, of course, the quality of the available healthcare is important too. Someone may have access to care, but when the care they get is poor, then they're less likely to have the same outcome as someone who has access to the latest and greatest. The physical space where we live, work, and play also impacts our health. Neighborhood and built environment is about both the outside space, including neighborhoods, roads, sidewalks, green spaces, as well as the structures in those spaces. Your zip code is now understood to be a stronger predictor of your health than your genetic code. The safety of your neighborhood also falls into this section. So that's going to include things like the level of violence and your comfort in being able to move about your neighborhood, which impacts your ability to access fresh air, spaces for physical activity, and ultimately your mental and physical well-being. There are also safety concerns related to a lack of infrastructure, which promotes healthy outdoor activity, like when there are busy roads and no sidewalks. And then the actual location of the neighborhood is a factor as well. Are you exposed to higher pollution in the air, land, or water because of where you spend your time? And then, of course, there are concerns related to the safety of the structures themselves and their quality. We will focus on housing and talk more in depth about how your housing impacts your health, things like access and stability, but also environmental hazards and concerns. So the fourth social determinant of health category is about relationships, the social ties that we have to others. This includes our individual relationships that we have with our family, our friends, coworkers, neighbors, as well as our civic participation, workplace conditions, the impact of incarceration, both on the individual who's incarcerated and their loved ones, and the effects of discrimination. While having no or few relationships or chances for engagement is bad for your health, positive experiences can actually undo some of the negative impact from the other social determinants on our health. I think this is huge because we can make changes to some aspects of our social and community context. And we can collectively push for improvement societally. Lastly, we have economic stability, which is about having stable, sufficient income to meet your basic needs, meaning you have enough income to cover things like your housing, nutritious food, clothing, transportation, and anything else you need to live a healthy life. An individual or family's economic stability is often tied to their employment status. Do they have a job? Is that job stable? Is it seasonal? Economic security is also impacted by food insecurity. When individuals don't have enough to eat, they struggle to do all of the other things they need to do because they don't have the energy to work or learn or process their surroundings. This impacts their ability to remain employed or to access education. It's also impacted by housing insecurity, which might be caused by economic instability, but it also contributes to it. Without an address, it's often very difficult to get a job or to qualify for government benefits. And those are meant to act as a safety net for people who are experiencing economic instability. And then, of course, poverty is also a factor that's associated with economic stability. When we talk about poverty, we're talking about the more than 1 in 10 people who live at or below 100% of poverty as defined by the government. For a family of 1, that's an income of $14,580 in 2023, or $30,000 for a family of 4. And nearly half the people who are living in poverty are actually living in what's referred to as deep poverty, or below 50% of the poverty level. Living in poverty impacts all of the other social determinants of health. Those who live in poverty tend to live in concentrated areas, and poverty tends to last a long time. We know that children who grow up in poverty are much more likely to live in poverty as adults than those who were never poor as kids. Poverty really ties into all of the other social determinants of health. So people from different cultures, different social classes, or with different levels of education might experience the same issue very differently because of different social factors. There are 3 major ways in which social determinants of health may impact different populations in different ways. These can be viewed as levers or points of intervention that can be used to address those social determinants and lessen their effects. So the first is difference in exposure. Certain population groups, because of economics, geography, or other factors, may be more likely than others to encounter particular health risks. People in poverty, for example, are likely to be exposed to higher levels of stress, economic uncertainty, and unhealthy conditions than wealthier individuals are. There are differences in vulnerability. Because of their poverty, their exposure to stress and uncertainty, or other factors, those same population groups might find themselves more vulnerable than others to health problems. The inability to pay for regular health care or medical treatment increases the possibility of chronic illness. And then there are differences in consequences. Differences in wealth, in social standing, in connectedness, and other factors can lead to very different outcomes where health issues are concerned. For a middle or upper class family, a minor health problem like missing a few days of work, paying a modest sum for treatment is likely just an annoyance. For a poor family, it might be the difference between a roof over their heads and homelessness, or between children attending school and dropping out to go to work. Discrimination, high stress levels, employment conditions, and other factors can lead to disparities in health and healthcare among different groups. We're going to focus on housing and how it works as a social determinant of health. Housing can be broken up into 4 different pathways that impact health, and I'm going to discuss each one. So we've got stability, quality and safety, affordability, and neighborhood. But again, these are all going to overlap some. If we think about housing stability as a spectrum, where at one end we have complete stability, where you live in a safe, secure home that you own outright with little to no chance of losing it. And at the far other end, we find homelessness. Homelessness is where you don't have access to stable, safe, functional housing. In 2020, at any given time, there were close to 600,000 homeless individuals in the US. And during the span of any year, up to 3 million individuals are without housing at some point throughout that year. 40% of those who are homeless do not have access to shelter of any kind. Increasing rates of homelessness are caused by economic instability, increasing inflation with wages that don't keep up, and a lack of affordable housing. People who are homeless have higher rates of illness, and they die on average 12 years sooner than the general US population. Poor health can be a major cause of homelessness, and homelessness exacerbates existing health conditions and can cause new ones to occur. It is much more difficult for people who are experiencing homelessness to recover and heal from injury or from illness. Individuals who are homeless experience a higher disease burden from cancer, including less access to medical care, screenings, and prevention, as well as higher morbidity rates. A little bit further up the spectrum are those who have housing instability. These individuals move frequently, they fall behind in their rent, or they stay housed by couch surfing. They are more likely to experience poor health in comparison to their peers who have stable housing. For teens and young adults, housing instability is associated with increased risks of teen pregnancy and early drug use, as well as depression. Foreclosure, or losing your home to your lender or the government, typically because you can no longer afford the costs of the home, is also associated with worsened outcomes in mental health and health behaviors. That includes depression, anxiety, increased alcohol use, psychological distress, and even suicide. The stress of unstable housing can lead to disruptions in employment, social networks, education, and government benefits. The lack of stable housing can also really decrease the effectiveness of healthcare because of things like not having a place to use or store equipment or medications properly. When individuals do not have a stable home to live in, there may be concerns about when individuals do have a stable home to live in, there may be a concern about the quality and the safety of their home. Substandard housing and risks associated with older homes can impact health. There may also be environmental concerns. So older homes built before 1978 are more likely to contain sources of lead, typically in older paint or in pipes. Exposure to lead can cause serious health issues for young kids, including developmental and behavioral issues. It can also increase the risk of developing Alzheimer's disease later in life. Usually this exposure happens because of chipping or peeling paint or deterioration in pipes. A few years ago, we saw an entire community experience exposure to increased levels of lead when the water supply in Flint, Michigan was contaminated by the deteriorating lead pipes. Water leaks in a home can cause mold and other allergens to grow. These trigger respiratory issues, including asthma. They also attract pests, especially cockroaches, which can also cause sanitary concerns. Radon is an odorless gas, which is common in some areas of the US, and it enters the home through the ground, often when there are cracks in the foundation or gaps in basement walls. This is the second leading cause of lung cancer behind smoking. However, many individuals are not aware of the risks of radon, and they do not have their homes tested for this toxin. Asbestos is a naturally occurring mineral, and it was frequently used in construction materials up until the 1980s because of its resistance to heat, electricity, and corrosion. We now know that exposure to asbestos can cause cancer and lung disease. Many homes still have asbestos materials, and they can be hard to identify. If you touch or move asbestos, especially when you try to remove it, it breaks apart and gets into the air, where you can breathe it in and put yourself at risk. There's also poor indoor air quality, including the effects of secondhand smoke, which contributes to cancer, cardiovascular disease, asthma, and other illnesses. You may also have around your home chemicals that can contribute to poisoning or have other longer lasting effects. Common chemicals like bleach, rat poison, paint strippers, and drain cleaners can be pretty dangerous. Finally, when regular maintenance and upkeep is skipped, whether that's because the owner is unable or unwilling to do it, safety issues are more likely to come up. And small issues can turn into big issues if they're ignored. Low-income neighborhoods are commonly located in areas made up of homes built before the 1980s. And property owners often take advantage of the vulnerability of tenants or renters and don't keep these living environments up to code. They're often unknowingly exposed to these risks that I just talked about that are associated with older homes, and those can have a long-lasting impact on their health. They're also often compelled to live in these conditions because there's a lack of affordable housing in the US, and landlords know that they can get new people to move in if the current tenants move out. Unfortunately, the burden of unaffordable housing itself can also lead to poor health outcomes. Housing is considered unaffordable or cost burdened when a household spends more than 30% of their income on housing. In 2021, there were over 19 million US renters who were considered cost burdened. The lack of affordable housing is disproportionately burdensome to Black and Hispanic populations. Individuals who are worried about their housing costs are more likely to be in poorer health and less likely to seek care often putting it off because of concerns related to cost. When they're burdened by housing costs, they also have less money to spend on healthcare and other essentials like nutritious food. There are many studies that link different kinds of conditions in neighborhoods with health. These include physical conditions, the services available throughout the neighborhood, and social conditions or relationships and opportunities for participation amongst community members. Healthy and unhealthy neighborhood conditions are not randomly distributed. People from racial and ethnic minority groups are more likely to have difficulty finding affordable and quality housing. And neighborhoods where populations with low income and minority populations live are more likely to experience harmful conditions like poor air quality and higher rates of pollution. They're also less likely to have health promoting conditions like sidewalks and bike lanes and parks. The root cause of many of these neighborhood inequities can actually be traced back to the practice of redlining. Redlining started in the 1930s when the US government took maps of more than 200 cities and coded them with colors based on the perceived creditworthiness of each neighborhood. The neighborhoods that were colored in red were determined to be not worthy of investment. And the result was that the government would not provide government-backed mortgages to people who wanted to buy houses there. The red neighborhoods were those that were mostly Black and mixed race neighborhoods. This is a clear-cut example of institutional racism. The result was that not only were people who wanted to buy homes in those neighborhoods unable to get government-backed mortgages, but other lenders stopped giving credit to the people who lived there too. It also reduced access for minority populations to things like public transportation, supermarkets, and healthcare. This is because companies also stopped investing in those neighborhoods. This historically discriminatory practice created neighborhoods that have school districts with inadequate funding, higher crime rates, and poorly resourced infrastructure. These conditions led to poor health outcomes for people living there. They're also more likely to have greater environmental pollution and less access to nutritious, affordable foods, which also compounds the issue. So now that we know about all of these ways that housing can impact our health and how it disproportionately impacts Black and other minority populations and people with low incomes, what can be done about it? The biggest opportunity for change will be at the policy level. There needs to be a push for more affordable housing and a push for improved quality in affordable housing. Neighborhood safety can be improved through initiatives that include community programming, more sidewalks, and bike paths, by bringing grocery stores that offer nutritious options back into neighborhoods, by reducing environmental toxins so we don't see another community being overly burdened like Flint, Michigan. There are some communities that have come up with some creative approaches to try to address some of these issues. In Arizona and Oregon, they're piloting the use of Medicaid funds to provide up to 6 months of rental assistance to help low-income individuals transition to stable housing. In doing this, Oregon found that providing access to safe, stable housing can improve health and reduce healthcare costs. Within a population of nearly 10,000 people in Oregon with unstable housing, providing housing decreased Medicaid costs by 12%. At the same time, this group increased their use of outpatient primary care by 20% and decreased the use of emergency departments by 18%. In other areas where rental and/or foreclosure assistance have been provided, there have been improvements in mental health and decreases in intimate partner violence. In one model, individuals who had been chronically homeless and who had behavioral health condition received supportive housing. And after taking into account the housing costs, there was a decrease in medical costs of up to $29,000 per person. Some cities have created a right to counsel program for tenants or renters who are facing evictions. Historically, tenants at risk of becoming homeless through eviction are rarely represented by an attorney in the proceedings, while most landlords do have an attorney. This puts tenants at a great disadvantage in the process, and they almost always lose. Once they've been evicted, it's harder to find a new place to rent, and it can have a domino effect on other aspects of their life. These right to counsel programs ensure that tenants who are facing eviction have access to an attorney. The programs help tenants avoid an eviction judgment or involuntary move in anywhere from 59 to 98% of the cases, depending on the city. These programs are really helping to support housing stability. There are also many hospital systems that are recognizing the impact of housing on health and are actually investing in it. So some examples of that include Bon Secours in Baltimore, which developed more than 700 affordable housing units for individuals and families who are in need. Children's Mercy in Kansas City has a Healthy Homes program, which offers environmental health assessments and repairs and renovations to improve housing stability in the community. And St. Joseph Health in California has a medical respite program for chronically homeless people who have been recently discharged from the hospital so that they have a safe, stable place to stay and recover. There are also hundreds of medical legal partnerships around the country, and those partner attorneys with medical professionals who can screen for concerns related to housing and other social determinants of health and provide a warm handoff to a legal aid or a pro bono organization who can help tenants with address those substandard housing conditions or issues related to housing instability and try to make improvements to their situation. On a more micro level, what can you do? Well, fortunately, there are some really simple ways to help make your home a healthier place for you and your family. HUD created the 8 Healthy Home Principles, which can help make your home a healthier place to live. The first principle is to keep it dry. You want to prevent water from entering your home through leaks in the roof, from rainwater that enters the home because of poor drainage. And you also want to check to make sure you don't have any leaks in your interior plumbing. You should keep it clean. You want to try and control the source of dust and contaminants in your home. To do that, you should have smooth, cleanable surfaces, reduce your clutter, and use wet cleaning methods. An example of that is using a rag wet with warm water and an all-purpose cleaner to wipe surfaces. This keeps the dust on the rag instead of putting it back into the air. You want to keep it safe. Store poisons out of reach of children and make sure they're properly labeled. Secure loose rugs. Keep play areas free from hard or sharp surfaces. Should have smoke and carbon monoxide detectors installed, and ensure you have fire extinguishers on hand. Want to keep it ventilated. So ventilate bathrooms and kitchens by opening windows or using a whole house ventilation system to supply fresh air. This helps reduce the concentration of any pollutants that are in the home. You want to keep it pest-free. All pests, bugs, mice, roaches, all those things, look for food, water, and shelter. To keep them out, you should seal cracks and openings throughout your home, anywhere they can sneak in. You want to store your food in pest-resistant containers. If you need to, you can use sticky traps and baits that have bait in closed containers. And if you need to use a pesticide, think about using things like boric acid powder, which is less toxic than traditional pesticides. You want to keep it contaminant free. If you live in a home that was built before 1978, make sure to fix paint that's chipping or peeling, and keep floors and windows clean using that wet cleaning approach to try and reduce the chance of lead poisoning. You should have your home tested for radon, and if the levels are high, you can have a radon removal system installed. If you're planning to do any renovations in an older home or think something might contain asbestos, it's the best to have it tested before trying to remove it. And there are professionals who can encapsulate or remove asbestos in a safe way. You also want to keep your home maintained. You should be inspecting, cleaning, and repairing your home routinely. Take care of minor repairs before they become large repairs and large problems. And then to reduce the risk from extreme heat or cold, you should keep your house at an appropriate temperature as much as you possibly can. So you may have heard those 8 healthy home principles and thought that as a renter, you can't make some of those changes. However, when you rent a home from a landlord, both you and the landlord have certain rights and responsibilities. Most of these are common sense, like you can't damage the property and you have to pay your rent. The landlord typically has the responsibility to keep the home habitable, and they can evict you if you fail to keep up your end of the deal. So what is habitability? It's maintaining rental units in a condition that is fit for occupation by human beings. The law in your state may be more specific about what exactly habitability means, but as a general concept, it has to be appropriate for a human to live in. When a rental home is inhabitable, there are some steps that tenants can take to get the problem fixed. Now, these are going to vary by state, but the first step is generally the same. You should contact the landlord to let them know about your concerns. It's best to do that in writing and keep a copy, even if that's by text or email. And then you should give them a reasonable amount of time to fix the issue. Again, this might be defined by state law, but often more urgent problems having to do with health or safety, like no heat in the winter or the presence of raw sewage, are going to need to be taken care of more quickly than things like a leaky faucet or a cracked window pane. If you have current concerns about the safety of your home, you can call your local health department or building department to see if they can inspect and order the landlord to fix the issue. You can also check with your local court to find out more about what the next steps would be in the process for getting things moving. You might be able to withhold rent, or you might have to pay it into an escrow account at the court if the landlord doesn't fix whatever it is that you've asked them to fix. You may also have to file something against them in court. All going to depend on the laws in your state. Another good source for this information about what options you have is your local fair housing organization. They offer free resources and they exist to eliminate housing discrimination and ensure equal housing opportunity. Here are some other resources that may be beneficial to renters who have concerns related to the habitability or the conditions in their home. At the national level, you can go to the National Low Income Housing Coalition or to the Department of Housing and Urban Development, or HUD. In your state and local areas, there are often community and social service programs like wraparound services, emergency assistance, and mediation. To find those, you can call the United Way's resource line at 211 or visit their website at 211.org. Then also check with your local court for any assistance programs. There may be free assistance available through a law school clinic or a local legal aid. And having a representative reach out on your behalf may be really useful to get your landlord moving in the right direction. If you're unable to pay your rent or your mortgage, and you're worried about an eviction or a foreclosure, there are programs that offer monetary assistance. During the pandemic, there was a lot of rental assistance that was easily accessible, but most, if not all, of those programs have closed. So now you're going to have to do a little more legwork to find help. 211 is, again, a great place to start. There are sometimes local or state government programs that can provide monetary assistance, but also local nonprofits and churches can be a source of assistance. Again, 211 should be able to point you in the right direction. If you're concerned about foreclosure, you can also access financial assistance to help with payments. 211 can tell you about local resources. You may also be able to work with your lender to figure out options you have to either put off payments or make changes to your loan. I suggest doing this sooner rather than later, as you're going to have fewer options available the longer you wait. You can check the website makinghomeaffordable.gov, which is run by HUD, to see what options you may have available. And as with all things, be careful for scams. If someone reaches out to you to offer assistance, make sure you're vetting them to ensure that the program that they're talking about is real and that whoever you're talking to is actually who runs the program. Get their number and verify it. Look at the email address to make sure it's coming from the source you think it is. And you can always call HUD to ask about a program if you're concerned. So when we consider that affordable housing is spending up to 30% of household income on housing, market rate rent is often far too high for individuals and families who have a low income. To address this issue, the U.S. Department of Housing and Urban Development, or HUD, has programs for renters with low incomes, including specific options for individuals with disabilities and for seniors. This is the main way that low-income renters can find housing that fits within their budget. You may have heard of Section 8, which is one of the federally subsidized housing programs, but there are a number of federal programs that can help subsidize or pay for rent based on someone's income level. Rent in subsidized units can be as low as $0 for people who have especially low incomes. So these programs include privately owned subsidized housing, which are typically apartments where all of the units are subsidized and the rent is based on your income. You typically apply for one of these units directly with the landlord. Public housing units are apartments for low-income families, the elderly, and persons who are living with disabilities. They're owned by the government, which might be HUD or a local housing authority, and you apply with the housing authority to get into these units. The Housing Choice Voucher Program, which is also called Section 8, gives the person who holds the voucher the ability to place it at a participating property. The voucher pays a certain dollar amount, and then the tenant has to come up with the rest, any rent over that amount. Vouchers are highly desired because they give people some control over where they get to live and allow them to live in neighborhoods that are not all subsidized housing. To get a voucher, you have to get on the waiting list. But the trick is that the waiting lists tend to be full and only occasionally open up for people to add their name. You can check with your local housing authority to see if your list is open, and if not, be on the lookout to add your name when it does open up. The biggest way that the government helps provide affordable housing is actually through the low-income housing tax credit program. And this is where an owner sets a lower rental rate in exchange for a tax credit. Rent in these units are not based on your income, but you do have to meet income criteria to be eligible when you move in. For these, you have to go directly to the landlord to apply. If you're not sure where to find any of these programs, HUD's website has several tools that are useful. They can help you find your local housing agency, find housing that gets low-income tax credits, and find your local fair housing organization. They also offer counselors who can walk you through eligibility rules or point you to subsidized housing in your community. For renters who are looking to get into subsidized units, because of the shortage of affordable housing, there may be wait lists, and the wait lists in some areas are years long. And that's because getting into subsidized housing is not typically a fast process. So you should try to get on as many waiting lists as possible because some are going to move faster than others. Also, make sure to update any changes in your contact information for any wait lists that you're on. Like if you move or you change your number or your email, you don't want to miss your chance to get into a subsidized unit. You should also follow up from time to time to see where you are on the list. This both confirms your interest in a unit and it ensures that you remain on that list. They may also be able to give you an idea of when you might be able to access a unit. If you're having trouble paying bills, there are also utility assistance programs, including the Low Income Home Energy Assistance Program, or LIHEAP, for heating and cooling costs, and the Low Income Household Water Assistance Program, which are available. If you're interested in trying to take advantage of these programs, you should try to apply early in the season because there's often a set amount of money that's allocated, and once the money's gone, it's gone. And then there are also federal programs that provide phone and internet access that you may be less familiar with. There's a Lifeline program, which provides phone service. You can apply for that at lifelinesupport.org. And then there's also the Affordable Connectivity Program, which is run by the Federal Communications Commission, or the FCC. And that offers broadband internet for low-income households. It also gives that a one-time discount to buy equipment to access the internet. So that can be pretty helpful. These programs and other sources of financial assistance are listed on our checklist for finding financial help. I find this checklist to be super useful when I'm trying to think through what options are out there for someone who may be dealing with economic instability. And in addition to the public benefits resources, it includes information about looking for help from nonprofits, foundations, and other private sources. I think it's a great way to double check that you've explored all avenues for financial help. And you should remember to be creative with your financial assistance. If you had a certain amount allocated for food, but now you're eligible for SNAP or food stamps, shift that money to pay for other bills. So earlier I talked about redlining and the ways that institutionalized racism had a ripple effect, which continues to impact the way that our neighborhoods exist today. During the civil rights era, there was a push to create laws to try and address and prevent discrimination. This week, we celebrate 55 years of the Fair Housing Act, or the FHA, which was signed into law on April 11th, 1968. The Fair Housing Act prohibits discrimination in all phases of the housing process, and it protects not only on the basis of race, but also on religion, national origin, familial status, sex, and disability. Since then, other laws have been passed that prevent discrimination in some aspects of housing for people who are living with disabilities. 5 years after the FHA, we got the Rehabilitation Act of 1973, which was passed to give equal access to people living with disabilities. Section 504 of the law prevents discrimination in public housing. I'm going to refer to that as Section 504. Much later, in 1990, we got the Americans with Disabilities Act, which prohibits discrimination on the basis of disability. In the housing context, it applies to public housing and public accommodations. I'm going to talk through some of the ways that individuals who are living with disabilities, which may include a cancer diagnosis, are able to use these laws to help make improvements to their housing situation. So Section 504 prohibits discrimination on the basis of disability in federally assisted programs or activities. The federally subsidized housing programs or public housing programs I talked about are subject to this law. Section 504 guarantees the rights of individuals with disabilities to participate in and have access to program benefits and services. The law protects both those who have disabilities and people who are associated with them, like family members and caregivers. What does that protection look like? Well, a housing provider cannot deny someone the opportunity to participate in a program or activity because of their disability. And they cannot require someone to participate in a program designed for individuals with disabilities. For example, if there's a swimming lesson available, they can't prevent someone from attending the regular swimming lesson, even if they have a special swimming lesson that's for individuals who have disabilities. Nor can they say that people with disabilities all have to live in a specific building or all on the same floor. They cannot refuse to make repairs or limit access to any of the amenities or keep someone from participating in a planning committee or on an advisory board. There must be equal access permitted. Under the ADA, we have housing protections for people living with disabilities in Title II, which covers public housing, and Title III, which covers public accommodations. You may be wondering what a public accommodation is. Public accommodations are facilities that are accessed by the public. So that includes things like a library or a store. But even when housing is private, for example, an apartment complex with no federal funding, they often have areas that are open to the public, like a rental office, a common room, or maybe a gym or a pool that's accessed by the public through a membership. Under the ADA, these public accommodations have to be made accessible for people with disabilities. For new builds, they have to meet the criteria in the ADA. For older buildings, barriers have to be removed wherever they can be. The Fair Housing Act, or the FHA, touches all aspects of housing. It prohibits discrimination in the sale, rental, or financing of housing to people in protected classes, which again includes race, religion, national origin, gender, and disability. We're now going to focus on the protections for people with disabilities, but it can be helpful to remember that there are other protected classes, especially if you think you might be facing discrimination for more than one reason. The Fair Housing Act protects you from discrimination when you're renting or buying a home, getting a mortgage, seeking housing assistance, or engaging in just about any housing-related activities. It is important to keep in mind that this law is applicable to anyone who's in the US, including our undocumented population. HUD is responsible for enforcing the FHA. Every law we talk about has its own definition of disability. The FHA defines disability as a physical or mental condition that substantially limits a major life activity. So you have a medical condition and it's impacting a major life activity. That impact has to be substantial. It can't be something that only happens every once in a while. And then the FHA defines major life activities for us as activities that an average person can perform with little or no difficulties. Breathing, walking, talking, eating, all of those things are considered to be major life activities. We can add to that list things like sleeping, concentrating, operation of major bodily functions, all things which are commonly substantially impacted by cancer. Once you show that you have a disability under the FHA, there are 3 ways to use the protections. The first is if you currently have a disability. The second is you have a history of having a disability, which is helpful for someone who's maybe no longer in treatment, but is concerned about being treated differently because of their history of having had cancer. And then the third is when you are regarded as having a disability. And that's really based on someone else's perception that you have a disability and they treat you differently because of it. So then how can someone with a disability benefit from the law? Well, it protects you from discrimination, meaning that a housing provider cannot treat you or your family, including your children, differently because of your disability. Caregivers are not specifically protected by the FHA, but we will see how someone might be able to use the protection with regard to a caregiver. And then if you currently have a disability or you have a history of having disability, you may be entitled to reasonable accommodations and/or modifications. In order to be protected by the FHA, you have to have a housing provider. A provider can include your landlord, apartment manager, or associations like HOAs or condo associations. For homeowners, it includes mortgage lenders, homeowners insurance providers, and realtors. Housing providers can also be individuals, corporations, property owners, co-ops, colleges, or even the government. There are a couple of circumstances when the FHA does not apply. It exempts owner-occupied buildings with no more than 4 units. A good example of that is a duplex where the owner lives in one side and rents out the other one. The FHA also exempts single-family houses which are sold or rented without the use of an agent, and housing operated by religious organizations and private clubs that are limited to members only. As I mentioned, the FHA applies in all phases of the housing process. When you're looking to rent or buy housing, you cannot be treated differently because of your disability. They cannot refuse to rent or sell to you or to negotiate with you. They cannot charge you a different price or set different terms because of your disability. When it comes to mortgages, the FHA makes it illegal to discriminate against someone because of those categories, including disability, at any stage in the mortgage process, from advertising to application to terms and conditions to servicing. After a cancer diagnosis, there are times when someone needs to make changes to their home so that they can continue to use and enjoy it. There are 2 types of changes they might need to make. One being a physical change, like a grab bar in the shower. The other is a change or an exception to a rule or policy, like being assigned a closer parking spot. When someone is making the change, they need to think about whether they can just make it themselves or if they need to get permission. And then who's going to pay for it? Under the FHA, you may have the right to reasonable accommodations and/or modifications to help meet your needs. A reasonable accommodation is a change to rules, policies, or practices that are related to your housing that give you full enjoyment of your home. Full enjoyment means that you can have the same benefit from your home as people without a disability. Reasonable accommodations in housing could include things like a parking space closer to your home, or moving to a ground level unit or a unit closer to an elevator if you have cancer-related fatigue or trouble walking. If you receive monthly income like an SSI or an SSDI payment, you might benefit from having your rent due after that payment arrives, like on the 5th instead of the 1st. You might even need a caregiver to stay overnight despite restrictions in your lease about overnight guests. Remember when I said that caregivers are not a protected category under the FHA? They aren't, but you might have a disability-related need for a caregiver. So you may be able to use the FHA to get a reasonable accommodation to have one. Where reasonable accommodations are changes to rules and policies, physical changes to your private living space or common areas are called reasonable modifications. And remember, we're discussing someone needing someone else's permission to make those changes. Reasonable modifications might include things like installing a ramp into a building, so that could be your particular space or the common area or both. Could be lowering the entry threshold of a doorway. Could be putting grab bars in a bathroom or a hallway, making wider doorways, lowering sinks and countertops. Maybe it's a change from doorknobs to handles. Think about what physical changes that are related to your disability that would help you better use your space. You might need more than one modification, and you may have more than one medical condition that's causing the need for change. Things you're going to want to think about before making any modifications are, do I need permission to make the change, and who's going to pay for it? Typically, if you're a tenant or a renter, you have to pay for reasonable modifications, and you may have to pay to return it back to the way it was when you move out. There is an exception to that if the person lives in housing that receives government funding. You can go to HUD's website to see if your housing gets government funding, and if they do, ask your landlord to make the modifications for you. If someone needs a reasonable modification but they can't afford it, they can look for help by going to 211. They can also check with their local fair housing center. A housing provider may not deny a reasonable and necessary request. But how do you know what is reasonable? It could be unreasonable if the burden or cost to the provider is too high, or if it would be a major change to the provider's business, like having to install an elevator in a 2-story building that only has 6 units. They can also deny it if there are other adequate choices available. Like maybe they offer you a ground floor unit instead of installing an elevator. And of course, they can deny your request if the property is exempt from the FHA. If you're considering asking for an accommodation or a modification, here are some things to remember. The first step is yours, and that is to ask for the change. You may be able to make your request verbally, but a request in writing is helpful. That way you can keep a copy for your records. The rules where you live might also require a written request. So you want to check to make sure you're following the rules. You may have to show how the proposed change is necessary and how it connects to your medical condition. Housing providers do not need to know the details of your diagnosis, only that you have a medical condition that qualifies you for the protection and that it is related to your request. So your request should include a statement that you have a disability and how it affects the use of your home, the reasonable accommodation or modification that you need, and how that reasonable accommodation or modification will help you use your home. You can get more than one, and you might need both accommodations and modifications. Your needs may also change over time. What you need in active treatment may be different from what you need 6 months out or 5 years later. Reasonable accommodations and modifications are not a one and done situation. You can make changes over time. You should attempt to use the interactive process where you make a request, and then if they cannot grant your exact request, you and your housing provider discuss and try to find an arrangement that works for you without imposing an undue burden on the provider. And keep in mind, just because a law doesn't require your housing provider to grant a reasonable accommodation or modification, doesn't mean you shouldn't ask. If you're responsible for the cost of a modification, but you can't afford it, and this is for both renters and homeowners, you may be able to access assistance through a grant. Grants can come from a variety of sources, so be open-minded. You might not find a grant to pay for a disability modification specifically, but you might get funding that you need from a home improvement or a repair grant. Good resources here are HUD, the National Residential Improvement Association with their free search engine, and the federal government specific programs like for people in rural communities and veterans. States, counties, and cities may have resources to fund your modification too. Look at your local housing agency, and HUD has offices in every state as well. You can also check with your area agency on aging. And then there may be private foundations and organizations with grants available. Some are specific to the disability or to the cancer community. If you don't qualify for grants, you might look into a loan, especially if you're a homeowner and you need to make modifications. And here are some examples of where you can look for a loan to help pay for the modification you need. So the FHA, or Federal Housing Administration, backs some of the loans related to housing, like mortgages. If you have an FHA-backed loan, and that includes a Fannie Mae or a Freddie Mac loan, there are specific loans that you might be able to qualify for to help make those modifications. They usually have a low interest rate, and some of them can simply be added onto your existing mortgage instead of creating a separate loan and a new payment. One's called the 203K loan. That's a home renovation loan that rolls the renovation costs into your mortgage. Another option is a HELOC, or a home equity line of credit. That's where you borrow against some of the equity that you have in your home. If you do that, you should shop around for a good rate. And remember that it doesn't have to come from the same lender as your mortgage. One thing to watch out for is that some loans can result in a lien on your home if you don't repay them. A lien means that the creditor, or the entity that loans you the money, has an interest in your property. If you haven't repaid the loan and you try to sell it, your house, a lien can hold up the process or even be subtracted from what you make from that sale. And a lien can also show up on your credit report and might lower your score. Let's talk for a minute about disclosing a cancer diagnosis to a housing provider. Do you have to do that? The FHA protects your privacy. For instance, you may not feel comfortable sharing details of your diagnosis with your landlord. You might not have to disclose anything at all. But if you're asking for a reasonable accommodation or a modification, you only need to share enough information about your medical condition to show why the reasonable accommodation or modification are necessary. For example, if someone uses a motorized scooter to move around and they ask their housing provider to permit them to install a ramp at the entrance of the apartment building, that's both an obvious disability and an obvious need for modification. The provider can see the scooter and therefore may not require any additional information about the disability or the need for the requested modification. Now, if the need for the accommodation or modification is not obvious, then the provider can ask questions, but only for necessary disability-related information. They can't require you to disclose details about the diagnosis or the severity of a disability, or ask for medical records, or ask you to take a medical exam. So what can you do if your request is denied? The first thing you should try to do is engage in the interactive process. But your provider might not be willing to engage in the process, or maybe they don't know that they're supposed to, or they might just not be nice enough to work with. You do have options. If the interactive process didn't happen or didn't work, or if your housing provider said no and you believe that no is wrong, you can file a complaint with HUD. Either do that directly or with the help of a local fair housing center. Fair housing centers are a good first resource as they can provide more detailed information about your rights and your options. Both HUD and fair housing centers will try to assist with the interactive process. If you can't come to an agreement, HUD may investigate the situation. And if they find discrimination, they will enforce your reasonable accommodation or modification, either themselves or through another agency. And even if HUD does not find discrimination under the Fair Housing Act, you might still be able to file a private lawsuit. And even though there are 3 different laws that protect you from housing discrimination, there's one place to file a complaint to report a violation of those laws, and that is through HUD. HUD gives you a number of ways to file that complaint. You can do it online, by email, by phone, and by regular mail. Again, you can also access a fair housing center and they can help you file a complaint. After HUD gets the complaint, they're going to investigate and try and find a way for both sides to come to an agreement. If the sides can't agree and the housing provider violated the law, HUD might take legal action. And even if HUD doesn't act, you may be able to file a private lawsuit. Retaliation is illegal, and that's important. So if you file a complaint with HUD and your housing provider is not permitted to retaliate against you, if you think your housing provider is retaliating, you can report that behavior to HUD. If you have questions related to housing after all of this, a good place to start is our quick guide to housing or our new housing module at cancerfinances.org.
Thank you so much, Melissa, for that great presentation. We have been answering questions in the Q&A box throughout this presentation. So I would like to remind everyone that a recording of this webinar will be available on our website later today. You can go to our website, navigate to the events tab, then click past webinars, and you'll be able to see our full archive of webinars, as well as resource documents pertaining to each topic. We hope you enjoyed this webinar, and to close, we'd like to emphasize that this isn't your last chance to learn with Triage Cancer. If you're interested in learning more about today's topic, or any of the topics on the next screen, we invite you to attend our Apex event, the Triage Cancer Conference. We offer this day-long event biannually and free of charge to anyone in the cancer community. We cover key information on how to navigate practical issues, how to minimize the financial burden of a cancer diagnosis, and how to reduce stress. And we also provide free contact hours and continuing education credits for healthcare providers. And for the healthcare professionals on today, we greatly appreciate the role you play in changing the lives of individuals impacted by a diagnosis, and we also recognize just how vast all of that information is. So to meet this need, we created a day-long insurance and finance intensive just for you. This training is free of charge, and it takes a deep dive into health and disability insurance, employment, and finances. This program also provides free continuing education credits for healthcare professionals. You can view our full 2023 schedule and register on our website. And as a reminder, if you have questions about your individual situation, or if you have questions related to the content of this webinar, you can contact our free legal and financial navigation program by filling out an intake form online and scheduling an appointment with our staff. We hope you will continue to stay connected with Triage Cancer. We invite you to attend more webinars, and we also encourage you to register for the second webinar in the Beyond Medicine series. Melissa will be our speaker again, and the webinar, Beyond Medicine, Your Community and Your Health, will take place on April 27th. We also encourage you to sign up to receive our blog and to connect with us on social media. I personally really like our blog because you can use the QR code on the screen to sign up. It's really easy. And then it just pops up into your inbox, and you don't need to remember to check our website for the important news related to the cancer community. And for the healthcare professionals on today, or individuals looking to distribute materials to your community, you can use the materials request form on our website to order printed materials and bulk materials, and we will ship them to you for free. And as a last reminder, in order to receive continuing education credit for today's webinar, you must have stayed throughout the entire webinar. You will receive an email tomorrow morning from Zoom, which will contain a link to the evaluation and the post-test. The evaluation requires your name and your email address so that we can certify you completed the entire evaluation. And that is also the email we will use to send the certificates to you within 4 weeks of tomorrow. Please complete the evaluation and post-test within 1 week of receiving the evaluation. And for the nurses and social workers, you must receive a passing grade of 80% on the post-test in order to receive credit. And if you see this message after you complete the evaluation and post-test, Your submission has been logged and you passed the post-test. There's nothing else you need to do except wait for your certificate within 4 weeks. And if you receive this message, which is a score less than 80%, you will have an opportunity to retake the post-test. You can copy and paste the link into your web browser. You don't need to resubmit the entire evaluation, just the post-test. And if you're having difficulty accessing the retake, please email info@triagecancer.org and we will help you out. Thank you all so much for attending. We hope that you found the information valuable, and we hope that you all have a great rest of your day.